Hey everyone, Tony Maritato here. So in this video, we're going to answer the question, does Medicare require a physician order, a referral, a prescription to start outpatient physical therapy, occupational therapy, speech therapy services? I'm going to take you into the Medicare Benefit Policy Manual. I'm going to show you the exact reference for where it states the answer to that question. If you're not familiar with it, I'll post a link to this exact manual down in the show notes, but Medicare Benefit Policy Manual, Chapter 15. This one was last updated February 2019. And so what we're going to do, we're going to come down. All right, and here we go. Section 220.1.1, Care of a Physician, Non-Physician Practitioner. Although there is no Medicare requirement for an order, when documented in the medical record, the order provides evidence that the patient both needs therapy services and is under the care of a physician. I am going to go ahead and highlight that just so we have it. The certification requirements are met when the physician certifies the plan of care. That is what is required. So you don't need, in terms of Medicare, you don't need the physician order, also called a referral, also called a prescription. You don't need that in the medical record. It's not required. What you need is a signed plan of care, a certified plan of care. Once you have that, that is basically what supersedes what would have been an order to start physical therapy, occupational therapy, speech. There is a time where the order may be required, and I'm going to talk about that in just a minute. But what's required is the certification, a signed certification by the referring provider. If the signed order includes a plan of care, which you'll find in section 220, I'm going to do a whole video on plans of care, no further certification is required. Payments dependent on the certification of the plan of care rather than the order, but the use of the order is prudent to determine that the physician is involved in care and available to certify the plan. So basically, the one time that you probably do need the order is in the case of a one-time visit where there is not going to be a long-term plan of care. The physician is sending a patient to you. They are going to get a home exercise program and be independent. You're not going to do a written plan of care. The order in that case would be for a one-time visit, home exercise program. That's the goal. Everything is included on the order. You do not need to have a certified plan of care in that case. Otherwise, if it's not a one-time visit that's covered by the order, you do not need to do an order. You do not need to have an order to start care. Now, based on your State Practice Act, there's going to be certain guidelines that will be required. But remember, there's a difference between State Practice Act and Medicare regulation. Okay, so don't get those two confused. You need to satisfy both, but they are separate and independent. So guys, I'll put this link to this PDF document in the notes. If you have any other questions, let me know. But one more time, you do not need a physician order to start physical therapy care as far as Medicare is concerned. You need to have a certified plan of care in place, and in the next video we'll look at what a plan of care must include. Thanks for watching, guys. I'll catch you in the next video.